ever feel like you're just drowning in information, trying to get a handle on something complex, and there's just so much stuff out there.
Yeah, the old drinking from a fire hose feeling.
Exactly. Well, that's what we're here to help with today. We're going to cut through all that noise and take a deep dive into a really important and honestly fascinating topic: conception failure and reproductive health in mares.
It's definitely complex. So many layers. And it affects a huge industry, obviously.
Absolutely. So our mission for this deep dive is pretty straightforward. We've gone through a whole stack of sources, everything from really detailed medical texts to practical guides on diagnosis and treatment, and we're going to pull out the key takeaways for you.
Sort of a shortcut to getting up to speed.
Precisely. Think about it. Mares are fundamental to the equine world, particularly breeding. So understanding their reproductive health, it's vital. Whether you're a breeder, a vet, or maybe you're just like us, fascinated by how biology works.
It's crucial knowledge.
Okay, so to really get into conception failure, we probably need to start with the basics. Just, how do mares reproduce normally? What does their cycle even look like?
Right. Well, mares are what we call seasonally polyestrous. Basically, their reproductive cycles are turned on by increasing daylight, so they're long day breeders.
Okay, long day breeders. Makes sense.
Yeah. And their cycle, the estrus cycle, averages around 21, maybe 22 days. That breaks down into two main parts. There's estrus, that's when the mare is in heat, receptive to the stallion.
Right.
It usually lasts, about 4 to 7 days.
Right.
And then there's diestrus, that's the longer phase, the luteal phase when she's not receptive. That runs about 14 to 15 days.
Okay, so that's the normal rhythm. Now, when we talk about conception failure, what exactly are we defining? Is it just, the mare doesn't get pregnant after breeding?
Well, it's actually quite a bit broader than that. Conception failure isn't just not pregnant. It includes any sort of maternal defect, structural or functional, that stops the fertilized egg from developing normally. Or it could be that the embryo doesn't make it into the uterus properly by about day 6 after ovulation. Or, even if it gets there, it fails to survive long enough for us to reliably detect the pregnancy with ultrasound, which is usually around day 14.
Wow. So it covers a lot of very early losses that someone might not even realize happen.
Exactly. It encompasses quite a bit before that first pregnancy check.
That's a much wider scope than I think most people would probably assume. And you mentioned something earlier that was really eye-opening. What's the sort of baseline failure rate, even in perfectly healthy mares?
Yeah, this is the surprising part for many. Even for young, seemingly perfectly healthy mares, the normal conception failure rate is around 30%.
30%? Wow.
Yeah, 30%. And that's the baseline. Now, if you're dealing with older mares or mares known to be subfertile, that number can just skyrocket. We're talking 50, even up to 70% failure rate in some cases.
Gosh, that 30% baseline really puts things into perspective, doesn't it? It almost feels like you're fighting biology from the start.
It kind of redefines what normal efficiency looks like in breeding, It tells us that even when everything seems perfect, there's this inherent biological challenge.
And I imagine the economic impact and the emotional side for breeders must be huge with rates like that.
Oh, absolutely immense. Every failed cycle is lost time, lost resources, and, a lot of disappointment.
Okay, so if that's the what, let's dig into the why. Why does this complex system hit roadblocks so often? Maybe start with things that prevent fertilization from even happening?
Sure. One of the biggest factors right off the bat is timing.
Timing. Okay, how critical are we talking?
Extremely critical. See, the mare's egg, the ovum, once it's ovulated, it has a really short lifespan. We're talking maybe 6 to 24 hours maximum.
That's it?
That's it. And its viability drops off really fast after just the first 6 to 8 hours. Now compare that to stallion sperm, depending on the quality, whether it's fresh, cooled, frozen. It can survive anywhere from hours to several days inside the mare.
Right. So you've got this potentially long-lived sperm waiting for a very short-lived egg.
Exactly. So getting the timing of breeding or insemination synchronized with that ovulation window, it's absolutely paramount. It's a very narrow target to hit.
Really highlights how precise things need to be. Okay, so timing is key. But what if the mare's own cycle isn't playing ball? Are irregular cycles a common issue?
They definitely are. We see several patterns. There's something called transitional anestrus, which happens in the spring and fall as mares are coming into or going out of their breeding season. Their cycles can be really erratic, prolonged heats. Follicles develop but don't ovulate. It's unpredictable.
Okay.
Then you can have a persistent corpus luteum, or PCL. The corpus luteum is what produces progesterone after ovulation, maintaining the diestrous phase. Normally, it regresses if the mare isn't pregnant, allowing her to come back into heat.
But sometimes it doesn't.
Right. With PCL, it just stays there, keeps pumping out progesterone, and prevents the mare from cycling back. And then, of course, there's just general anestrus, a complete lack of cycles. That could be seasonal, which is normal in winter for many mares, or it could be due to poor nutrition, stress, or some underlying health problem.
So beyond the cycle itself, what about issues with the ovaries directly? Are there specific conditions there that really throw a wrench in the works?
Oh, for sure. One we see fairly often is a type of ovarian tumor called a granulosa cell tumor, or GCT.
Okay, a tumor. How does that affect things?
Well, these GCTs are often hormonally active. They can produce hormones, sometimes even testosterone.
More testosterone. In a mare?
Yeah, and that can really mess things up. It can suppress the function of the other ovary, stop her from cycling altogether, and in some cases, the mare might actually start showing stallion-like behavior.
You're kidding. Like what?
Like becoming more aggressive, mounting other mares.
Yeah.
It could be quite dramatic.
Wow, that's wild. So a behavioral change could actually be the first clue.
It absolutely could be. A savvy owner or manager might notice that change, and that prompts the vet check leading to the diagnosis. It's a good reminder that if a mare stops cycling, it doesn't automatically mean she's barren. It could be something treatable like a GCT.
That's a really important point. Are there other ovarian issues besides tumors?
Yes. In older mares, we often see ovarian atrophy, where the ovaries just shrink and don't produce as many good follicles. And sometimes mares develop what are called anovulatory follicles. These are follicles that grow quite large, sometimes even painfully so, but they just fail to ovulate.
So the potential is there, but it just doesn't complete the process.
Exactly. And tying into that, especially with older mares, say over 18 or so, or mares with maybe chronic health issues or poor nutrition, the quality of the egg itself, the oocyte, can be a major problem.
Ah, so even if ovulation happens, the egg itself might not be viable?
Precisely. The quality might be compromised from the get-go. It's a fundamental piece of the puzzle.
Okay, so we've covered fertilization issues. Now, let's move inside to the uterus. If fertilization happens, what can go wrong there? You mentioned the uterine environment.
Right, and this is a huge area. Honestly, if you ask vets what the single most common cause of infertility in mares is, the answer is almost always endometritis.
Endometritis, so inflammation or infection of the uterus.
Exactly. Now, it's interesting because mares naturally have an inflammatory response right after breeding. It's designed to clear out excess semen, debris, any bacteria introduced. It's normal.
Okay.
But in some mares, particularly older mares or those with maybe poor conformation, this response becomes excessive or doesn't resolve quickly enough. We call this acute post-breeding endometritis. They accumulate fluid inflammatory cells, and that creates a really hostile environment for any embryo trying to survive in there.
So the mare's own defense mechanism sort of backfires.
In a way, yes. For these susceptible mares, it does. And beyond that acute post-breeding type, you can also have persistent chronic bacterial infections or even fungal endometritis, which can be incredibly stubborn and difficult to treat.
So it sounds like it's not always an active infection per se, but even just the presence of fluid is bad news.
Absolutely.
Right.
Any significant fluid accumulation in the uterus, even if it's sterile, is detrimental. It physically interferes with the embryo's ability to move around the uterus, which is essential in the early days for signaling pregnancy to the mare. And the fluid itself is often inflammatory, making survival tough.
Like trying to set up camp in a swamp.
Pretty much. And then there are other structural things within the uterus. We often see endometrial cysts. These are fluid-filled sacs in the uterine lining.
Cysts. Can they cause problems?
They can, especially if they're large or very numerous. They can physically block the embryo's migration or interfere with the embryo signaling its presence, what we call maternal recognition of pregnancy. Or later on, they might prevent the placenta from attaching properly. And another big one, especially in older mares, is uterine fibrosis. This is essentially scarring of the endometrium, the uterine lining, particularly around the glands that nourish the early embryo.
Scar tissue, basically.
Right. And the more fibrosis there is, the less capable the uterus is of supporting a pregnancy, especially providing nutrients through the placenta. It really reduces the chances of carrying a foal to term.
So issues within the uterus are clearly major players. What about sort of structural problems leading to the uterus or the mare's overall build?
Yeah, definitely. Sometimes the problem starts further out. We can see cervical abnormalities. The cervix is the barrier between the vagina and the uterus. If it's damaged, maybe from a previous difficult foaling lacerations, adhesions, it might not close properly during pregnancy.
Which could let infection in.
Exactly, leading to ascending infections.
Mm-hmm.
Or the damage might interfere with sperm transport getting into the uterus in the first place.
Makes sense. And you mentioned conformation earlier. How does the mare's physical build play into this?
Okay, let's unpack this because it's really significant. We talk about conformational defects, and the classic one is poor perineal conformation. You might hear breeders call it wind-sucking.
Wind-sucking.
Yeah. It happens when the mare's vulva isn't vertical and well-sealed. Often in older mares or thinner mares, the anus can seem a bit sunken, and the top of the vulva gets tilted forward towards horizontal.
Okay, I can picture that.
So what happens is every time she moves, or even defecates, air, and worse, fecal material, can literally be sucked into the vagina.
Oh, wow. Straight into the reproductive tract.
Yep. And that constantly introduces contamination bacteria, setting her up for chronic vaginitis and, inevitably, endometritis. It's a huge predisposing factor. Another related issue is urine pooling, or vesicovaginal reflux, where, again, due to poor conformation, urine pools in the vagina instead of flowing out cleanly.
And that causes irritation and inflammation, too, I assume.
Exactly. Chronic irritation, inflammation, and that can easily ascend into the uterus as well.
Gosh, it seems like everything has to be perfectly aligned, almost literally. Okay, so even if fertilization happens, the uterus is okay, the conformation is good, mares can still lose the pregnancy early on, right? What's early embryonic death, or ED?
Right. ED is another significant hurdle. This is pregnancy loss, typically before day 35 or 40. And it can happen for a bunch of reasons. Maybe it's that uterine hostility we talked about, underlying endometritis, fibrosis, cysts that finally catch up with the embryo.
So the environment just isn't supportive enough.
Correct. Or it could be an issue with the embryo itself, genetic abnormalities. This becomes more common as mares age, tied back to that oocyte quality issue.
Okay.
Hormonal problems can also cause ED. The most common is insufficient progesterone production from the corpus luteum. Progesterone is absolutely essential for maintaining the pregnancy early on. If levels drop too low, the pregnancy will likely fail.
And what about twins? You hear about twin foals sometimes, but is that actually a problem?
It's a major problem in horses. Sounds nice, maybe, but the mare's uterus just isn't designed to support two pregnancies adequately.
Really? Why not?
There's just not enough placental surface area to nourish both fetuses properly. So if a mare conceives twins, and it's not managed, meaning one embryo isn't eliminated very early on by a vet, it almost always results in the abortion of both foals, often mid-gestation. Or, if by some miracle they survive, they're usually small, weak, and it's very high risk for the mare too.
So twin conception is actually something vets actively try to prevent or manage immediately.
Absolutely. Routine early ultrasound checks are crucial for detecting twins, so one can be dealt with, usually by manually crushing one vesicle to give the remaining one the best chance.
Wow. Are there other sort of external factors that can trigger ED?
Yes, definitely. Significant stress on the mare can contribute. Things like severe illness, high fever, maybe stressful long-distance transport, extreme heat or cold, even sudden changes in nutrition or management can potentially disrupt that delicate hormonal balance and lead to pregnancy loss.
It really is a complex picture. So many potential pitfalls. It makes you wonder how any foals get born at all sometimes.
I'd have to feel that way.
So with this huge list of potential problems, how on earth do veterinarians figure out what's actually going on with a particular mare? How do they diagnose these things?
It all starts with a systematic approach,
Yeah.
usually centered around what we call a breeding soundness examination, or BSE.
Okay, BSE. What does that involve?
It's comprehensive. First, a really detailed history is vital. We need to know about her past foaling experiences, any previous fertility issues, how regular her cycles are, what breeding methods have been tried, things like that.
Considering all the clear.
Exactly. Then a general physical exam. Is she healthy overall? Importantly, what's her body condition score? Ideally, for breeding, mares should be in moderate condition, say a 5 or 6 on that 1 to 9 scale. Not too thin, not too fat.
Right.
And then a very careful evaluation of that perineal conformation we talked about, checking the angle of the vulva, the seal, looking for signs of wind sucking or potential for urine pooling.
Okay, that makes sense. Then you move internally. This is where palpation and ultrasound come in, right? Those seem like the real power tools.
They absolutely are. Indispensable. Rectal palpation allows the vet to feel the cervix, the uterus, the ovaries, assess their size, tone, texture. You can feel follicles, corpus lutea, and then transrectal ultrasonography. That gives us incredible visual detail.
What can you see with the ultrasound?
So much. We assess the ovaries in detail, count follicles, measure them, look for abnormal structures like tumors or those anovulatory follicles. We evaluate the uterus, check for fluid, which shows up black on ultrasound, look for cysts, assess the uterine lining, the endometrium.
And it's used for pregnancy checks, too.
Crucially, ultrasound lets us diagnose pregnancy very early, usually around day 14 or 15. And critically, it allows us to detect twins when they're still very small and manageable. We also use it serially to track follicular growth and predict ovulation very accurately for timed breeding.
So palpation and ultrasound are central. What about tests for infection or inflammation, that endometritis?
Right. For that, we typically perform a uterine culture and cytology. A sterile swab or brush is used to collect a sample from the uterine lining. The culture attempts to grow any bacteria or fungi present so we know what we're dealing with and what antibiotics might work.
And the cytology.
Cytology involves looking at the cells collected under a microscope. Specifically, we're looking for inflammatory cells, like neutrophils. Their presence confirms active inflammation, helping diagnose endometritis even if the culture is negative.
Okay. And I've heard about uterine biopsies being important, too.
Yes, the endometrial biopsy is an extremely valuable tool, especially for prognosis. A small piece of the uterine lining is taken.
What does that tell you that the other tests don't?
It gives us a look at the actual tissue structure. We can assess the severity of inflammation, but more importantly, we can evaluate the degree of fibrosis, that scarring we talked about, and also check the health of the endometrial glands.
So it predicts her chances of carrying a foal.
Essentially, yes. There's a grading system, the Kenny-Induid classification system, that categorizes the biopsy findings. Based on the grade, we can give the owner a much better idea of the mare's likelihood of successfully conceiving and carrying a foal to term. It helps manage expectations and decide on treatment paths.
That sounds incredibly useful. Are there any other diagnostic tools used in more complex cases?
There are. Sometimes hysteroscopy is used. That involves putting a small camera and endoscope directly into the uterus.
So you can see inside.
Exactly. It allows direct visualization. You can see adhesions, scar tissue, maybe small polyps or cysts that weren't clear on ultrasound, or even locate foreign bodies sometimes. We can also do hormone assays, blood tests, to measure levels of hormones like progesterone, to confirm ovulation or check if pregnancy is being maintained, or estrogen sulfate later in pregnancy, which reflects fetal viability.
Okay.
And in cases of recurrent pregnancy loss, especially early loss, karyotyping might be done. That's a genetic test to check the mare's chromosomes for any abnormalities that could be causing the problem.
Wow, quite the diagnostic toolkit. So once you've done all that detective work and hopefully pinpointed the problem, what then? What are the treatment options? You said it's specific, right?
Yeah, very specific.
Yeah.
Treatment has to be tailored to the diagnosis. There's definitely no single magic bullet. But broadly, we can group treatments. First, there's managing breeding timing and cycles.
How do you manage cycles?
Well, for mares that aren't cycling early enough in the season, we can use artificial lighting, extending their perceived day length to 16 hours, usually starting in late fall or early winter. That tricks their body into cycling sooner.
Clever.
We also use hormones quite a bit. Prostaglandins, like PGF2 alpha, can be used to short cycle a mare, bringing her into heat sooner if she has a functional corpus luteum. We use GnRH analogs, like deslorelin implants, or HCG, to induce ovulation predictably within about 48 hours, which is huge for timed insemination.
And progesterone.
Progesterone, or synthetic progestins, can be used to help synchronize mares for things like embryo transfer programs, or sometimes, controversially, it's supplemented in early pregnancy if there's concern about the mare's own production, though the evidence for its effectiveness there is debated. And of course, basic good management, like teasing with a stallion to detect heat, combined with that serial ultrasonography, is vital for nailing the timing.
Okay, that covers timing. What about treating endometritis, that really common issue?
Right, treating uterine inflammation or infection. Often the first step is uterine lavage.
Flushing the uterus.
Essentially, yes. Large volumes of sterile saline solution are infused into the uterus and then drained out. This helps physically remove inflammatory debris, bacteria, residual semen. It cleans things out.
Makes sense.
Often after lavage, we give medications like oxytocin or a prostaglandin analog like cloprostanol. These cause the uterus to contract strongly, which helps expel any remaining fluid and debris.
And antibiotics.
If the culture identified a specific bacterial infection, then yes, intrauterine antibiotics are often infused directly into the uterus. The choice of antibiotic is ideally based on the culture and sensitivity results, so we're targeting the specific bacteria effectively. Fungal infections require specific antifungal treatments, which can be challenging.
Okay. What about those structural problems, like the poor conformation or cervical tears?
Those often require surgical correction. For windsucking, due to poor perineal conformation, the standard procedure is the Castelic's procedure, or episcioplasty.
What does that involve?
The vet surgically sutures the upper part of the vulvar lips together, effectively sealing it closed to prevent air and fecal contamination from entering.
Does that stay closed forever?
No, that's important. It needs to be opened before the mare foals, or she'll tear badly. So it's usually open close to her due date and often needs to be redone afterwards if she's being bred back. For more severe conformational defects or issues like urine pooling, more extensive perineal reconstruction surgeries might be needed. And obviously, significant cervical tears or adhesions often require surgical repair as well.
It's amazing what can be done surgically. Now, what about those advanced technologies you hear about, especially for maybe older mares or ones with really persistent uterine issues or poor egg quality?
Ah, yes, the advanced reproductive technologies, or RTs. This is where things get really fascinating and offer hope for mares who might otherwise be unable to produce a foal. The most established is probably embryo transfer, or ET.
How does that work?
With ET, you breed the donor mare, the one with the problem, maybe an older competition mare with uterine scarring or just high value. Then, around day 7 or 8 after ovulation, you flush her uterus to recover the tiny embryo. And then you take that embryo and transfer it into the uterus of a healthy, reproductively sound recipient mare who's been synchronized to be at the same stage of her cycle. The recipient mare then carries the pregnancy to term.
So you completely bypass the donor mare's uterus issues.
Exactly. Or maybe she has musculoskeletal issues making carrying a foal difficult. EP bypasses that. It's hugely valuable.
That's incredible. Are there others?
Yes. For mares with very poor oocyte quality, or maybe stallions with very poor semen quality, there's intracytoplasmic sperm injection, or ICSI.
ICSI. That sounds complex.
It is. Oocytes, eggs, are collected directly from the mare's ovaries, often via ultrasound-guided aspiration. Then, in the lab, a single sperm is selected and injected directly into each mature oocyte. If fertilization occurs and an embryo develops, it's then cultured for a few days before being transferred into a recipient mare, similar to ET.
Wow. Single sperm injection. That allows you to use very limited or poor quality semen, I guess.
Precisely. Or get multiple embryos from a single oocyte collection cycle from the mare. There's also oocyte transfer, which is less common now with ICSI's success, but it involves transferring the collected oocyte directly into the oviduct of a recipient mare who has been bred, letting fertilization happen inside the recipient.
These technologies really push the boundaries. It's amazing what's possible.
It truly is. But, beyond all these specific treatments and high-tech solutions, we can't forget the foundation. Just good, solid, general reproductive health management.
What does that entail?
It means ensuring the mare is on a proper vaccination and deworming schedule to minimize any systemic illness that could impact reproduction. Maintaining that good body condition through balanced nutrition. Practicing good biosecurity on the farm to prevent the spread of venereal diseases between mares and stallions.
The basics are still fundamental.
Absolutely. And something we always strongly recommend is a thorough pre-breeding exam before the start of every breeding season, especially for mares who were barren the previous year or maiden mares. Catching problems early before you invest time and money in breeding attempts is key.
So it really comes down to a partnership, doesn't it, between the owner, the manager, and the vet?
Definitely. Success, especially with problem mares, really hinges on that close collaboration.
Yeah.
Working with a veterinarian who has expertise in reproduction, often a specialist called a theriogenologist, and following a logical diagnostic and treatment plan that gives you the best shot.
Listening to all of this, it really paints a picture of just how incredibly intricate mare reproduction is. So many steps, so many biological processes that have to go just right, and consequently, so many potential points where things can go wrong, from a microscopic egg or sperm right up to the mare's overall physical shape and health. It's such a delicate dance.
It really is. And I think what this deep dive shows is that conception failure in mares is rarely simple. It's almost always multifaceted. You might have a mare with some age-related fibrosis and borderline conformation, and she's a bit susceptible to post-breeding endometritis.
Multiple factors stacking up.
Exactly, which is why that thorough diagnostic workup is so critical. You have to identify all the contributing factors to create the most effective, tailored treatment plan for that specific mare. Like we said, no magic bullets. It's about understanding her unique set of challenges.
And as we wrap this up, something that really strikes me, Thinking about that baseline 30% failure rate, even in young, healthy mares, it really underscores how delicate the whole process of creating life is.
It does.
It makes you realize just how remarkable it is every single time a healthy foal does arrive safely. It's this incredible combination of, well, biology, veterinary science, good management, maybe a bit of art, and definitely a whole lot of patience.
Couldn't agree more. It's a testament to persistence, both the mares and the breeders.
Absolutely. So keep that curiosity going, keep diving deep into the things that fascinate you. Thanks for joining us on this deep dive.
Yeah, thanks everyone. See you next time.